Good morning, everybody. I'm the Ambassador of Italy. I would like to welcome all of you to Palazzo Borromeo on behalf of my staff, my wife Claudia, and tell you how glad I am today to have you, Don Dante, with us. It's a pleasure, it's a gift, and we all at the Embassy are really happy to host this event here at the Embassy. Dr. Tomaliti, distinguished guests, excellencies, colleagues, ambassadors, I'm really pleased, and as you know, Africa has become more and more a priority for Italy, and in particular for this government. And the summit hosted in Rome at the end of January was only the first international event Italy organized since assuming the G7 presidency, confirming that, as the Italian Prime Minister said, this is a precise foreign policy choice. Italy is absolutely aware of how interconnected the destiny of Europe and Africa are, and this is why it is working to write a new page in the history of our cooperation through the launch of the Piano Mattei, and whose main idea is to have a partnership, to develop a partnership with African countries absolutely on an equal footing, with solidarity offered also through faith-based organizations. And some of the Catholic religious organization has been asked to participate actively in the steering committee of the Piano Mattei. So, welcome to you all, and Don Dante, the floor is yours.
Good morning to everybody, many friends of us, but also the special guests and partners. I'm very happy to greet and welcome you in this wonderful place. Dear Excellency, dear Ambassador Francesco Di Nito, thank you a lot for this opportunity. It's a very good opportunity. Cuamm is an FBO, faith-based organization. Cuamm is based on Diocese of Padova. Is born in 1950, and since then is focused on health sector in poor countries to strengthen the local, the African health system. Cuamm decided to support other FBOs. Here we have many sisters, many congregations. Because FBOs are essential providers of health care in Africa, delivering between 30 up to 70% of services in low, middle income countries. So a big contribution. Underestimated contribution. This is important. This is why it's important to raise the awareness about this contribution. They often work in remote and very fragile areas, the last mile of the health system, we say, to meet the needs of the poorest people. Despite their importance, FBOs address many challenges and constraints also. This report is the first result of our support to understand what is the situation, the real situation on the field. This is the meaning of this report. An assessment conducted on the field in sub-Saharan African countries during the last 2 years to identify challenges and needs, but also even strengths and opportunities. The assessment covered 63 health facilities across 11 countries managed by 48 faith-based organizations. We are here today together because together all stakeholders, partners, friends can work to support and reinforce the vital role played by FBOs in delivering healthcare services to vulnerable populations. Jesus bless our commitment, our life, and our work. Thank you again.
Compassion, solidarity, and dedication. These are the values that guide faith-based organizations in their deep commitment to serve communities in need. Even in the African last mile, where needs are greater and responding to them is harder, FBOs are on the front line of service delivery. Both in contexts of crisis and development, faith-based organizations play a crucial role in providing quality health services to the most vulnerable populations in Africa, resulting in effective impact and long-term change. They are in close contact with local communities and can recognize and address the real needs of the poorest, delivering services in remote areas, complementing and enhancing efforts by local and national governments. However, FBOs in Africa are often neglected in terms of supplies, human resources, funding and visibility, with the risk of going unnoticed by the international community and potential partners. Moreover, they are often not integrated into healthcare systems. In 2019, Doctors with Africa, Cuamm, started a program to support faith-based organizations, and it is currently supporting 133 congregations in 26 African countries by increasing their capacity and resilience through 3 main activities: development and provision of training packages on health facilities management and administration, project management, resource mobilization, emergency management, and disaster preparedness. Technical assistance conducted through field missions by Cuamm experts and targeting hospitals, health centers, and dispensaries. Advocacy on the role of faith-based organizations in healthcare provision in Africa, sharing lessons learned and best practices with local, national, and international stakeholders. Faith-based organizations are fundamental partners to work towards universal health coverage and address global health priorities.
Buongiorno, good morning. It's good to see everyone on this beautiful day. Can you imagine how glorious? We have to take appreciation just a beautiful day like this and to be together for such an important event. I'd like to thank His Excellency Ambassador Denito, Father Dante for their opening remarks. My name is Gary Cohen. I'm best described as a friend of Cuamm, as a collaborator, as a donor, and as a partner. And I've worked in the business sector. I've served as a UN commissioner on the board of UNICEF. I've founded a nonprofit that's working globally. And I've traveled to over 70 countries. So I've had the opportunity to see a lot in my lifetime. And I can tell you that Cuamm is the most purely good organization that I've encountered in all my work, the most aligned with its purpose, with complete sincerity. So whether you know Cuamm well and you're an existing partner today, or whether you're being introduced to Cuamm today, I can say from my own experience, it's a privilege to be associated with this organization. And I hope that you'll find ways to support them because, as Father Dante said, Cuamm, through its partners, are reaching the most difficult to reach places and serving the needs of the most poor. It's a very, very important mission and purpose. It's my pleasure now to introduce our first speaker, who is Dr. Tom Aliti. Dr. Aliti is the Commissioner of Health Services, Health Sector Partners, and Multi-Sector Coordination for the Ministry of Health in Uganda. Dr. Aliti, we'll give you the floor.
Thank you very much for the introduction. Your Excellencies, distinguished guests, ladies and gentlemen, I would like to take this opportunity to thank Cuamm for the invitation. I've been part of Cuamm for many years in Uganda. I'm very happy to have been invited to speak at this very important event whose theme is Connect, Strengthen, Empower faith-based organizations in delivering healthcare services. Uganda has a very wonderful health system and very strong. And we have a health sector development plan whose goal is to have a healthy and productive population. We have a very strong partnership with the faith-based organizations. And this partnership has been growing for many years. And Cuamm and the Uganda Catholic Medical Bureau have been at the center of this strong partnership. The government of Uganda, through the Ministry of Health, enacted very many laws, policies, frameworks, and standards. For example, the public-private partnership in health to enhance this partnership. To operationalize this framework, government has put down structures such as the technical working groups in the Ministry of Health, extended district health management teams at the decentralized level, the Health Policy Advisory Committee at the Ministry of Health, joint review missions, and the faith-based organizations, including Cuamm, are much represented at all these governance structures. And this helps us to jointly plan, jointly review our performance, and jointly agree on priorities for the proceeding years. FBOs like Cuamm, Caritas, Avis, the Uganda Catholic Medical Bureau have for many years been a strong partner in the achievement of better health outcomes in Uganda. As indicated in the SDG report, the the Universal Health Coverage Trends, and also the Uganda Demographic Health Survey 2022. Most of the interventions of faith-based organizations are funded by donors, but the government of Uganda funds a few health facilities which are supported by FBOs. And the major areas of support include comprehensive healthcare delivery, support to the health workers through training, research, and capacity building. There are efforts of digitalization of our data systems. They support supplies, essential medicines, and health supplies, equipment. There are areas of good governance, leadership and management training, empowerment, and also emergency response. The impact of this contribution has been a reduction in morbidity and mortality and more especially for children and women in the rural areas. And this has impacted positively on the lives of the rural poor and also enhanced life expectancy in Uganda. The FBOs serve with a mindset of evangelization and pastoral renewal, and because of that, they have a lot of influence on the community. But beginning a few years ago, there has been a rising costs of inputs, and the scope of health service delivery in some of the FBOs is being scaled down due to financing constraints. And for the case of Uganda, it is even overstretched because of existence of 1.5 million refugees from Democratic Republic of Congo and South Sudan. And this has strained the healthcare delivery. About 2 years ago, the government of Uganda increased the salaries, the take-home pay for health workers, clinicians in public health facilities by 300%. And this is impacting negatively on the faith-based facilities because they cannot afford to pay that big salary of clinicians, and this has increased attrition in the faith-based facilities. And also retention of health workers is now a very big challenge. I appeal to the global partners to continue to support the FBOs in Africa, and because the FBOs touch the lives of the rural poor. And we look forward to a very strong partnership going forward, and we look at areas of stronger contribution, empowerment to communities, and focus on health education, health promotion, and disease prevention. The threats of climate change need to be taken at the center of these interventions. Thank you very much. God bless you all.
Thank you, Dr. Alidi. So we're going to have 3 panel sessions today with distinguished speakers. Our first session is going to be on the work of international cooperation agencies in healthcare in Africa. And it's my pleasure to introduce our first 2 speakers, Peter Natiello, who is Senior Humanitarian and Development Advisor for USAID, the Bureau of Humanitarian Assistance, and Juliet Pradhan, Deputy Director Development Policy for the UK Foreign Commonwealth and Development Office for FCDO. Now, Peter, if your name was Romeo, I could introduce Romeo and Juliet as our first speakers, but for today it's going to be Peter and Juliet. Please come take your seats here. And our format, so that you're aware of how things will operate today, is I'll have a question for each speaker, and then they have prepared to make remarks today to share with you their thoughts on the topics that we're going to discuss. And Peter, we're going to start with you. So USAID or USAID has a long history of working with faith-based organizations. So why are these partnerships important to USAID and the US government, and what does USAID's religious engagement look like in actual practice?
Thank you, Gary, for that question. And thanks to Cuamm. Father Dante, thank you so much for the invitation today. Thank you, Ambassador, for opening this beautiful embassy to us, and it's wonderful to be a part of this. So thanks for the question. Let me take the question in sort of 2 parts. Let me talk about share a personal experience, which I think is very consistent with what we've heard this morning and what we saw in the video earlier. And then let me just talk a bit about USAID's work with several faith-based organizations in Africa under what we call our PEPFAR program. This is the President's Emergency Program for AIDS Relief. It's I think the largest national investment in a single disease in the history. And faith-based organizations have played a critical role there. Personal anecdote, and I sort of hate to do this, but let me go to another part of the world for just a minute. Let me go to Latin America. About 16 years ago, I was working with USAID in Bolivia. And we had a partnership with a faith-based organization to work in a community called Tomoyo. Bolivia is one of the poorest countries in the Americas, and the region where Tomoyo is located is the poorest region in Bolivia. So again, this is last mile communities. The kinds of challenges that we've heard about this morning are precisely the kind of challenges that you find in Tomoyo. It's a high altitude community. It's dry, it's disconnected, it suffers from drought. And we had a small grant with this faith-based organization to work on water, to work on health, and to work on nutrition. So I spent a few days with this NGO before we went to the community. I wanted to see the work that we were doing there. I was, as we pulled into this community, Tomoyo, I was frankly pretty stunned. I was pretty stunned by the bounty in the community. There was irrigation. There was incredible production. There was corn, potatoes, quinoa, beans. There was commerce. There were trucks coming in and out of the community. They were healthy kids. I mean, the kids in this region of Bolivia normally suffer from upper respiratory diseases. They suffer from some level of malnutrition. They suffer from stunting, right? These kids were healthy. They were playing out on the roads. They were playing soccer. They were riding their bikes. They were smiling. This community, something happened in this community, and it was pretty stunning. I asked my colleague from this faith-based organization, tell me this story. Basically what he said, and he said it with such incredible passion, he said 12 years ago, people were either dying in Tomoyo or leaving Tomoyo. They were dying from lack of water, from tuberculosis, from maternal child mortality. And it became apparent that this person who worked for this faith-based NGO was just extraordinarily committed to this community. And I quickly learned that I think 98% of the staff of that particular NGO worked in their communities of origin. You could feel and hear the Christian values in his voice as he relayed this story. Love, hope, faith, respect for your fellow man and women. And I was just so moved by it. And as I left Tomoyo and went back to my job in the capital city, I said to myself, this is an incredible return on a very small investment. And the reason it's an incredible return is not just because, we were able to buy the bricks and mortar for the irrigation canal. It wasn't because of that. It was because we were putting our money in the hands of an organization that was so deeply committed to this. And they were there long before USAID had ever been there, and they're going to be there long after USAID is there. But what I learned on that visit is that what faith-based organizations bring is trust, access, again, really strong and healthy Christian values. And those are the intangible assets that are critical to success in any development project, right? And so that was it was certainly a career-changing moment for me when I saw that work being done by that faith-based organization. And it's precisely those things and those intangible assets that make faith-based organizations such an important partner to USAID. And just very quickly, in Africa, the work that USAID is doing hand in hand with Cuamm in Uganda has been critical to strengthen local health systems in those isolated places where precisely those refugees have put additional stress on those health systems. So hats off to Cuamm for that work, and we're very proud of that partnership. If you look to Eswatini and you look at the work of Cabrini Ministries to support women entrepreneurs so that, small businesses, so that they don't have to enter into high-risk sexual transactions as livelihoods for their families. Like that work by the Cabrini Ministries has been absolutely critical under our PEPFAR effort. And finally, in Kenya, the work that we do with the faith-based organization MEDS has been critically important to help strengthen supply chains and to get life-saving medicines and health support out to, again, many of these last-mile communities that we've heard about today. So thank you to the faith-based organizations here today and all over the world that are doing such incredibly important work. We're very proud to partner with you. Thanks.
That's wonderful. Thank you, Peter. Your personal testimony really brings to life what we're here to talk about today, and USAID's support of reaching the last mile, USAID's support of Cuamm is extremely important. So thank you for sharing that with us today. So Juliet, in a recent white paper that was published by the UK government, it was stated that dialogues with faith-based organizations are essential for international development. Do you expect that in the coming near future that FBOs will become more and more relevant to UK priorities and entities?
Thank you very much. And thank you very much, Father Dante, Ambassador, and to Cuamm for having me today. I think the short answer is yes. Should I stop?
Well, expand a bit.
Okay, great. So in our recently published development white paper, we set out an approach to the partnerships that we want to see in the future. And we want to shift the way that we've been working on international development to partnerships that are much more deliberately founded on mutual respect, that with an emphasis on country ownership, on accountability, on transparency, and on looking at our common values. And as part of that, we're committed to working towards more inclusive and locally led partnerships and approach to the way that we work on international development. And we see that faith-based organizations in that respect are important partners for us. So as Chris, our ambassador here would tell you as well, we've been saying for some time that faith leaders can speak to hearts where politicians cannot. The ability of faith-based organizations to link to the communities, to influence behavior. So, for example, during the COVID epidemic, we saw the bishops at the forefront of having vaccinations to let their populations know that that was a safe and a good thing to do. So the role in influencing is really important to us. But then also that last mile that the ambassadors know that you spoke about, you spoke about in the opening remarks, is really important to us. So if we want to work on local leadership, we need to work with the people who understand the community dynamics. And that's the first part. And the second part is then in some of the most fragile countries where we know that the poorest people are, where we want to develop our approach even further, then faith-based organizations have a major role to play in being able to have that kind of reach where local governments and other partners can't. I think in the white paper we still say that the ideal would be for states to be accountable to their citizens and for that state-citizen relationship to be really strong so that in the long run we know we've got long-term sustainable development, but we also know that the reality is that in many of those most fragile environments, there isn't that state-citizen compact, or citizens can't always benefit from being provided with healthcare or education or social protection, all of those things that they need, and that's where the church has and other local organizations have a major role to play. I'll maybe leave it there, but just to say that personally, I've worked in DRC for 4 years. I've worked in Sudan and South Sudan for 3 years. I've seen it firsthand, the role of faith-based organizations, for example, in Bukavu and Goma, working with survivors of sexual and gender-based violence, or in South Sudan, working on education. We know that the church has massive outreach and faith-based organizations. One of the things that we would be looking for in our future partnerships as well is to understand how that all adds up together. So my colleague here was talking about the role of the government in Uganda and how faith-based organizations link in with government systems. If we could understand better, and the video also pointed out, if we could understand better how faith-based organizations interact with other local systems, then we have better avenues for partnerships going forward. So we don't want to detract from the diversity and the reach and the trust that the communities have in faith-based organizations. But for a big donor, I can't call us donor anymore, let's call us a partner, like the UK, then it's very important to understand what's the totality and how do we work together. So that's something we'd want to see going forward.
Well, it's wonderful, Juliet. And so it's impressive that your experience with the last mile is not just one, let's say, somewhat removed. You've worked there yourself, you understand firsthand. And I think your comments also provide testimony to the reach that faith-based organizations have into communities, which, in some cases, governments assist that reach. Sometimes, depending where you are in the world, it could make things more complicated. And working through faith-based organizations ensures that reach to the communities and the ability to access the faith that exists gives an opportunity to have impact far beyond what otherwise might be achieved. We're going to have Q&A, questions and answers, at the end of the session for all the speakers. Part of my responsibility is to keep track of time, and I can tell you we are a couple of minutes ahead of schedule, which is wonderful. So if Juliet, if there's anything else you'd like to add as final thoughts, we have a few moments.
Thanks, and I do have a little commercial interruption, so I appreciate this. I really appreciate this. I'm on instructions from Washington to let folks know that just as an indication of how important faith-based organizations are at USAID, we just recently unveiled our first ever USAID agency policy on strategic engagement with faith-based organizations. 3 objectives: ensure that our staff has the capacity and the training that they need to effectively engage faith-based organizations, to ensure that working with faith-based organizations is integrated across all the sectors, not just health, but all the sectors that USAID works in, and in the countries where we work. And I'm going to get the 3rd objective right here, right now, so hang on with me. And the 3rd objective is to just ensure that, I'm sorry about this. Yeah, just to improve collaboration, of course, between our agency and between faith-based organizations. This policy rests on values of respect, inclusivity, and reaching the most vulnerable. So if you're interested in learning more about that, it's on our website. We have a center for faith-based organizations at USAID in Washington, and one of the things they do is just provide information and support to faith-based organizations who are keen to work with USAID. So we can provide information through Laura and through Andrea to the folks here today on how to reach that center if you're interested. Thank you very much.
Thank you, Peter. And I want to thank the organizers as well. This is the first time in my life I've been the tallest person in the front. It's never happened, even though I'm sitting. So thank you for this special chair. So thank you so much. And so I'll thank our speakers. Thank you, Juliet. So we're going to invite up our next panelist, if you want to take your seats. And so I'm going to now invite Filippo Umberti, who is head of health at ENI, or ENI, which is an Italian energy company that's headquartered here in Rome, and Eva Kujiman, philanthropy officer, Caritas Pro Vitae Gradu Charitable Trust. And we also have a 3rd speaker who will actually speak first, but she's not here with us today. Her name is Sister Jane Wakahiu. She's Associate Vice President of Program Operations and Head of Catholic Sisters Initiative for the Conrad Hilton Foundation, and she's going to speak with us via a video message. So we'll roll the video message, and then we'll turn to our 2 in-person speakers.
Greetings from the Catholic Sisters Initiative at the Conrad N. Hilton Foundation. I am Sister Jane Wakahiu, a member of the Institute of the Little Sisters of St. Francis from Kenya. I serve as the Associate Vice President of Programs Operations and Head of Catholic Sisters Initiative at the Hilton Foundation. I represent the Conrad N. Hilton Foundation, which was established in 1944 with a mission that calls us to love one another, for that is the whole law. The peoples of the world deserve to be loved and encouraged, never to be left to wander alone in poverty and darkness. Our founder, Conrad Hilton, was an avid entrepreneur who created a global empire in the Hilton hotels industry. When he died in 1979, he left 97% of his wealth to the foundation to do charity and alleviate human suffering. A faith-filled individual and a supporter of Catholic sisters, he instructed the foundation to relieve the suffering, the distressed, and the destitute, to shelter little children with the umbrella of your charity, to support the Catholic sisters who devote their love and life's work for the good of humanity. Since his early life, Mr. Hilton supported Catholic sisters and their ministries. He valued Catholic sisters so much that he charged the foundation to give the largest of its benefaction to sisters. The support reflects a commitment to upholding the principles of Catholic social teaching, including the affirmation of human dignity, solidarity, subsidiarity, and preferential option for the poor. Our ultimate goal is to empower the global Catholic sisterhood, which is a dynamic network of over 700,000 vowed women religious who are deeply rooted in faith and a belief in the dignity of every individual. Recognizing the commitment of Catholic sisters as leaders and advocates within their communities, their lives serve as a prophetic witness. Through local, national, and global partnerships, we aim to support sisters in transforming the lives of children, youth, families, and communities worldwide. Conrad Hilton's profound respect for the work of Catholic sisters inspires the Catholic Sisters Initiative to fervently carry out on his legacy, fostering strong and sustainable congregations, delivering effective services, and promoting collaboration on a global scale. I am delighted today about the partnership with Doctors with Africa, Cuamm, to enhance the capacity of over 100 Catholic sisters involved in healthcare in Ethiopia and Central Africa Republic. Strengthening and networking sister-led healthcare facilities is crucial for improving service delivery and fostering thriving communities. Catholic sisters are widely trusted for providing quality healthcare services, particularly in remote areas where their facilities are often located. Our support to organizations like Doctors with Africa aims to build robust networks of sisters and strengthen holistic care delivery systems, ultimately leading to improved health outcomes in those communities. Catholic sisters in Africa actively promote healthcare and protection, embodying a commitment to restoring the whole person and reflecting Christ's healing ministry. They operate in close proximity and solidarity with marginalized populations, recognizing healthcare is a fundamental human right. In impoverished regions like Africa, the absence of health insurance often turns curable illness into potential death sentence due to unaffordable healthcare access. It is our collective responsibility to collaborate with and support sisters in perpetuating Christ's ministry, providing compassion and tenderness to those in need. Thank you, Doctors with Africa, Cuamm, for your partnership and for improving healthcare delivery in Africa. You are helping us to fulfill Mr. Hilton's call to relieve the suffering of the distressed and the destitute.
Well, that's a hand for Sister Jane. So Filippo, we'll start with you. So Annie has long implemented programs of growth and development for local entities in African countries. And in many situations, you've seen this work firsthand. So for a private, public, international company, we spoke a bit. So Eni is both a private company, but partially government owned, so private, public. You know, what have you found to be the benefit of partnering with FBOs? And I know we spoke about return on investment, which is not something you typically hear about, but I think you've been very satisfied with the return on investment. So let me turn to you.
Yeah. Thank you for the question. But first of all, let me thank our Father Dante, that is my personal friend. So it's a pleasure to stay once again with you and with Cuamm organization. And let me thank also the Italian ambassador in the Holy See that is hosting today. I start to respond describing the challenge to manage the health for Eni, because I don't know if you know, Eni is an energy company, so there is a challenge in order to protect the health of our employees and the communities that are using to host us under the technical profile, because an energy company is a company that makes energy from fossil, so from oil and gas, and you know the relationship between historical relationship between this business and health. But now we have another challenge, that is the opportunity to produce energy from non-fossil. That is maybe also a greater challenge for my particular area of management, that is health. But the other challenge is related to the new context, that is the climate change and the relationship between climate change and the health, and the right attention, the proper attention to the public institutions like UN, WHO, ILO too, for the work and the right of the workers about the health. If you add that Eni has a particular mission that is focused in the sustainment of, in the development of the global objectives of development, you know that, you understand that for us, speaking about numbers, we work in 72 countries. We have around 33,000 employees plus families. We used to manage directly the health for millions, around 2 million of people, considering, and also the contractors, the families, the locals, and so on. For us, this is very important. So health is something on the base of our business activity. Going back to FBSO, we need, at the moment that we have fixed our objectives, we need to be consistent with them, to be trustable with the community, international community, local communities, because consider that energy is not like financial business. Energy is strictly connected to the real on-field activities. You have direct contact with the people. But it's not so easy for an international company like us to interact directly with the local population. The big opportunity is to interact and to speak and to have the aid, the support of FBOs, because they know the people, they know the environment, they are trustable in terms of ethic values, and going back to the field activity, they are a real partner of each entities, public, private, that want to invest in health. But it's not so easy, because our language, I have spoken about indicators, I have spoken about investment, and it's not easy to speak directly with them, because they are focused on the population. So for us, is important the role that, for example, Cuamm is playing for us, because Cuamm can understand our mission, can understand our priorities in terms of reporting activity, and can interact for us with FBSO. We have, for us, is also the best way to be out sometimes of the market of the NGOs, because at the moment that we go straight to FBSO, we are in a comfort zone, and sometimes in the market of NGOs, not so comfortable. Let me say at the end that we have a very, very nice experience in Côte d'Ivoire, where we have a project with Cuamm and with the Union of Catholic Doctors and Persons in the country. They have more than 68 sites. They work for the health of the local people, and we support them in community health, in capacity building, in access for the healthcare of mother and child. I can guarantee that their objectives are also in this life, not only in the life of the future, in that one life. So thank you again.
Thank you. Yeah, while we all may care about what happens past this life, let's do everything we can in this life for the purpose of this life as well. So Eva, first let me say I probably mispronounced your last name. It's not Kujiman, it's Kuijman? Koyman. Okay, I mispronounced it twice. Koyman, now I have it right. And originally from Holland, now living in Geneva, correct? Okay. So you represent Caritas Pro Vitae Charitable Trust, also faith-based. Could you please tell us about your commitment in supporting FBOs through the work of an NGO such as Doctors with Africa, Cuamm, that's operated at field level since 1950? What's been your experience?
Absolutely. Thank you, Gary, for the question, and thank you for inviting me to be here. So I'll start out by saying that Caritas Pro Vitae Gradu Charitable Trust has been working with Catholic congregations and Catholic dioceses, Catholic NGOs since we started in 2012. And we mainly focus on helping the most vulnerable people in these types of projects. We try to be as efficient as possible. And we try to push the Catholic values of compassion, respect, tolerance, and love of thy neighbor. FBOs on the ground are the people that know exactly what is needed. And that is why we work with Catholic congregations locally, because they know better than anyone what could help their communities. They have deeply rooted connections. They are decision leaders. They have a cultural understanding that we will never have for the local situation itself. They have personal knowledge. They have passion and dedication. And the only thing they need is the support and the resources to be able to reach as far and wide as possible. So that's where we come in. Now, when we started with Cuamm many years ago, our friend Cardinal Silvano Tomasi introduced us. We were delighted to see an organization that is so efficient and so clear in their communication, but also very well organized and focused on being leaders of change in local situations where there are not enough support organizations. By collaborating with Cuamm, we are able to strengthen their capacities, we are able to provide technical support, access to resources, and expertise that they cannot find locally. Now, through many of our projects with Cuamm in all of the countries that they work in, we have been able to promote health, well-being, and dignity for all. We are proud to show the world the impact that faith-based organizations can have when they receive the help and support that they need. And that is why we are a proud partner of Cuamm and will be for the foreseeable future. And I'm very grateful to be here today, so thank you.
Well, thank you. Well, as you mentioned, Cardinal Tomasi, I had the privilege of visiting with him yesterday, and I can report he is as busy as ever. The phone was ringing constantly. We had our meeting. He's getting calls from different parts of the world, and you know, we had a nice conversation about all the problems in the world, and there are some problems now. So we have to do our work together to counteract the things that are taking maybe the world in the wrong direction in some places. We do again have a few extra minutes, so I would invite you, if you have any other thoughts that you'd like to share with our esteemed audience here. I also want to mention something that struck me while you were speaking. You know, I think I'm going to take a leap and guess that everyone is feeling pretty good right now. You know, I think you're sitting here, you're hearing these speakers, you're learning about Doctors with Africa, Cuamm, their incredibly important work, and you feel good. It's one of the privileges of doing this work. And let's not underestimate how important it is. And it's not that you feel good, it's why you feel good. You know, there's an expression I learned that the body wants to feel good, the ego wants to look good, the soul wants to be good. You have that opportunity to be good, it feeds your soul. This is associated with affiliating with an organization such as Cuamm. And I would say it's an opportunity not to be missed. Anything else you'd like to share?
The point is very important, I think, to understand what is the opportunity that the FBOs have. Because if they can be connected to the part of the donors and the implementators, but just at a different level, if they can be opened to this area, they can increase also their role on the ground. And again, thank you to Cuamm because has understood this great opportunity. So thank you.
I just wanted to add as well that I forgot to mention that one of the main reasons why Cuamm is such a good partner for us is we work with a lot of local dioceses and local congregations, but they can only reach their local communities, whereas Cuamm is able to reach 133 faith-based organizations. And so your reach is so much further than anything we could have hoped for. And when you came to us with this idea in the beginning, we were enthusiastic, but we had no idea how much of a change you could make. So we're very proud, and thank you so much for involving us in this project.
We've now reached that all-important time of coffee break, and I think Rome is known for having excellent coffee. So I'll invite you to take a break, and we have a little bit of extra time. I think maybe we'll go at 20 minutes. I'll look at my boss here, Laura. What do you think? Go all the way, half hour? Yeah, so 15 minutes, 15 minutes. Then it's going to end up being 20. So yeah, okay. So 15 minutes break. We'll come back here at approximately 11:20 a.m. going from here to Parma, and then and then Sunday morning I'll fly back from Milan. Yeah, yeah, direct. To get started again, welcome back. We made sure that the coffee break was long enough to make up for all the time we had made up before, so we're back on schedule, not ahead of schedule, but that's fine. And before we start with our next speaker, it's my pleasure to acknowledge the presence of the Italian Navy here today. And I'll ask the representatives of the Italian Navy, please stand. It's an honor to have you here. And, you know, I think what I've learned in our conversation is that in fulfilling the responsibility of the Navy to provide security, let's say for Italy, for Europe, for the world, the method of doing so, you know, some of it is a projection of strength, but you shared with me that cooperation and working with the local entities actually advances security even more so. So it's a very enlightened view, and we thank you for that service that you're providing. So next we're going to hear an important report that Dr. Emanuela Parato is going to be presenting, and it's going to be, she'll be speaking with us about a needs assessment. We're going to learn about the needs that have been identified that are being fulfilled by faith-based organizations. So Emanuela.
So, good morning, everyone. My name is Emanuela Parotto. I'm an Italian physician, and I currently work as an anesthesiologist and intensivist at Padua University Hospital in northern of Italy. And I also collaborate with Cuamm as a clinical advisor. Before starting my presentation, I'd like to express my sincere gratitude and all my thanks to the authorities present here for this invitation. In this presentation, I'll illustrate the main findings emerging from multiple Cuamm health needs assessment missions. These missions were performed in the context of a Cuamm project aimed to strengthen the capacity and the resilience of faith-based organizations managing healthcare facilities in sub-Saharan Africa. As you know, FBOs are crucial in delivering quality health services to the most vulnerable population in Africa. FBOs are frequently on the front lines of service delivery because they are in close contact with the local communities and they can recognize and address the real needs of the poorest, delivering services in remote areas. And FBOs are often neglected in terms of supplies, human resources and funding, and they are often not very well integrated into the healthcare system. So, the Cuamm project included 3 main core activities: training, technical assistance, and advocacy. Training activities were aimed to develop and provision training packages to FBO staff. Technical assistance was a core activity aimed to target health needs of healthcare facilities and to provide technical assistance. And this activity was implemented through a mission on the field conducted by Cuamm experts. And the third main activities was related to advocacy in order to disseminate the work done by FBOs and to advocate for the better integration and support of FBOs in healthcare system. In this presentation, I show the findings emerging from the second activities, technical assistance activities. In particular, I'll illustrate the findings emerging from Cuamm assessment conducted in the field in the last 2 years. Each assessment mission included a visit on the field to talk with FBOs representative and staff members in order to obtain a deep overview of the services provided and to gather details on their quality and on the overall condition of the health care facilities. To do this, we administered and we used two different survey tools, two questionnaires named Facility Assessment Questionnaire and Disaster Preparedness Questionnaire. These tools were developed taking into account the main international guidelines in terms of health facilities management, in particular the guidelines developed by the WHO organization, the World Health Organization. After the questionnaires administration, we conducted during the visits in-depth interviews with key staff members to further understand the challenges, needs, and strengths of each health facilities. We assessed health facilities located in 11 different countries, shown in this map, 63 health facilities managed by 48 different faith-based organizations. The facilities assessed presented heterogeneous characteristics in terms of typology, infrastructural properties, and also in terms of health services offered. It emerged from these assessments that health facilities, FBOs, and the health facilities managed by FBOs played a crucial role in serving vulnerable population. And these health facilities demonstrate an important resilience despite major gaps in infrastructure and services. The health facilities assessed were equally distributed between rural or semi-rural areas and urban and semi-urban areas. The typology was heterogeneous, but we decided to group all the facilities in three main categories, named dispensary, health center, and hospitals. As you can see from the graph, in each country, we visited equal distribution between health centers and hospitals and a small proportion of dispensaries. Inside each category, however, there was a certain heterogeneity because, for instance, about health center, the services provided can be different. There were some health centers able to provide delivery assistance, for instance, but other health centers that provided only daily assistance without in-ward admissions for patients. Also, among the hospitals, we reported some differences because there were district hospitals, and also in the assessment we included also main hospital named tertiary referral hospitals that provide advanced care for the most critically ill patients. As I told you before, the challenges and needs reported were extremely heterogeneous, depending on the type of the health facilities, on the location, urban versus rural, for example. But there were some common domain shared by all the health facilities. And we identified 6 main areas of interest illustrated in this table: human resources, health services delivered by the health facilities, challenges in terms of logistics and infrastructures, challenges concerning management, financing, and integration and coordination. Each domain included multiple challenges. For instance, regarding human resources, the majority of health facilities experienced issues in terms of human resources because they complained a shortage of health professionals and also low retention and high turnover of the staff. So this issue impacted negatively the assistance to the vulnerable population. The interview reported during the visits on the fields that the existing health services were in need of implementation and in need of renovation in order to better assist the population. They had multiple logistics and infrastructural issues regarding, for instance, the maintenance of the infrastructures, but also the provision of electricity and water, and also there was a general lack of adequate data collection system. This is an important issue because it impacted negatively the possibility to share data and to disseminate results and best practice from the health facilities. And also there was a general weakness or lack of an adequate referral system, and this was particularly pronounced in rural and semi-rural health facilities that reported many issues in referring patients with critical ill needs. Also, the management of health facilities was reported as a problem due to the lack of a dedicated committee able to ensure an adequate governance and resource management of the health facilities. The majority of the health facilities reported multiple financial constraints because their income depends mainly on the fees by patients, paid by patients, with a lack of support from the government. And another important pillar, another important domain regarding emerging challenges is related to the integration and the coordination with the national health system, but also with other FBOs operating in the same country and with other non-governmental organizations. Let's take a look more in depth about these results. For instance, talking about electricity, as you can see in this graph, all the health facilities assessed can rely on the access to the grid, but it's important to underline that many facilities, despite the connection to the grid, the access to the grid, suffered from extended periods without electricity. This is particularly pronounced in rural and semi-rural areas. As you can see, these facilities suffered about more 100 days per year without electricity, and this impacts negatively, obviously, the assistance to the patients. As I told before, another important challenge regarded the referral system because a significant proportion of the health facilities reported issues related to the lack of ambulances. As you can see from this graph, there are a country between the health facilities assessed that complained the lack and the absence of ambulances. So they experience serious difficulties in refer patients in need of more advanced care. This is a challenge particularly pronounced in relation to specific clinical diseases or conditions. Let's take a look at obstetric assistance, for instance. As you can see in this graph, many of the health facilities assessed ensure assistance for vaginal deliveries, and they can rely also to an adequate technology and equipment. They have ultrasound machines, for instance. But the same health facilities that can provide assistance for vaginal deliveries do not have operating theater that are very important in case of emergent cesarean section. So women in this need have to be referred to more advanced hospitals, but if you keep in mind the problem related to the referral system, the challenge is strongly impacting the provision of assistance. The second tool we used was regarding the disaster preparedness. The majority of these health facilities were situated in hazard-prone areas, so they referred about floods, droughts, strong winds, and disease outbreaks that can impact negatively the provision of the assistance to the population. Despite this fact, many health facilities were not part of a disaster preparedness and management program. For instance, many health centers were not included in epidemiological surveillance systems programs, and the majority of the staff members reported the lack of essential components of disaster preparedness. For instance, only a small proportion of the health facilities had contingency plans in place that give them the opportunity to face disaster and emergencies. So, taking into account all these findings, together with our local partners, we thought about some possible recommendations to address the challenge and to implement the provision of assistance. These recommendations regard the main domains identified before, in terms in human resources, of health services, infrastructure, energy and water, management and data system, resource mobilization and financing, and FBOs representations. For instance, concerning human resources, it's important to promote measures aimed to ensure staff retention, implementing salaries, offering advanced training programs. In relation to the health services provided, it's important to adopt measures aimed to facilitate the access of the most vulnerable patients and to ensure also the adherence to standard guidelines aimed to maintain a continuous quality improvement of the health facilities. It is important to improve energy access and to promote measures aimed to better maintain the equipment and the devices used by the health facilities. It's important to standardize data collection procedures and management committees for adequate governance of the health facilities. And most of all, it is extremely important to strengthen the relationship with the local governments to promote donors' relation and to strengthen FBOs networks. All these measures are important to better disseminate the strengths and the best practices adopted and in place in the health facilities managed by FBOs. To conclude, this report confirmed that FBOs played a crucial role in delivering healthcare services to vulnerable populations. And we can say that by prioritizing the improvement of human resources, specialist services, financing and infrastructure, stakeholders can work together to better address the multiple challenges and needs faced by FBOs. There is a general need for sustained engagement and support for FBOs to achieve lasting impact and to advance towards universal health coverage in sub-Saharan Africa. At the end of this presentation, I'd like to thank all the staff members, all the FBOs representatives, and all the Cuamm members involved in these needs assessment missions. Working directly on the field allowed us to better a deep and a comprehensive understanding of the role played by FBOs. And last but not least, I'd like to thank you all for your attention. Thank you very much.
So, Emanuela, that was a fantastic report and an important report. And two things I want to do, because we have a little bit of extra time. You were so efficient and clear in presenting it. So in a moment, I think, I know I'm breaking a little bit from the protocol, but we'll see if anyone has any questions about the report while you're here. I also want to mention, you spoke about the challenges associated with childbirth and when the delivery cannot be done vaginally and there's obstruction or difficult labor, trying to transfer a woman or a girl, often it's girls, some countries more than half of pregnancies are girls, and they're much more vulnerable. The maternal mortality rate for girls if they're 15 or younger is 5 times higher than a woman 20 or older. If they're between 15 and 19, it's 3 times higher. And what I'm spending my life doing now is developing an innovation to assist childbirth in circumstances of difficult labor that could be applied in a remote setting, taking away the need to do a cesarean section, something that doesn't require surgical facilities. And if you wonder, and this has already been gone through human clinical studies in the UK and France, the next step is to go into a low resource country, low-resource healthcare locations, and to start to introduce this device into use in a clinical study. And who do you think we're partnering with to do that? Of course, Doctors with Africa. Cuamm has perfect access. So next month, I'm planning to be in Ethiopia with Laura to launch this work. It's just an indication of how significant what you've presented is. And healthcare delivery is challenging under any circumstance. You can go into the top hospitals in the most sophisticated, wealthiest cities in the world and find real challenges for health workers to deliver effective healthcare. But then think about doing that in a circumstance where something as basic as electricity is not available. I've experienced it. I was in the largest public hospital in Kinshasa some years ago in DRC, and there was a young girl. She looked like she was 3. She was actually 6. And she was dying. And in that facility, there was a doctor, there were no nurses, there was no medication. We had to go across the street just to get an IV bag for this little girl. And there was no electricity, and it was getting dark. So one of our delegates held the iPhone with a flashlight, just to be able for this girl to be treated, which was not going to happen successfully there. So fortunately, I was with people who were able to transfer her to another hospital just by chance that we were there. And she was treated for tetanus, completely treatable. And she wouldn't have lived more than a few more days. So this is the reality that we're dealing with. And when you have organizations like Doctors with Africa, Cuamm, that are supporting those operating on the front lines, we can't all operate on the front lines. We may want to, maybe we don't want to, I don't know. But we can't all be there. It makes it incumbent upon us to support the organizations that are on the front lines. That's our responsibility, just like they're taking responsibility to work in these difficult conditions. So any questions for Emanuela while she's here? And if you don't have questions now, we will have another Q&A session. Yeah, Peter.
Thank you for the presentation, Doctor. Just where can we get, we can probably have the report today, but is it available online? Because I want to share it with our colleagues.
Yeah.
Andrea, all the way in the back.
So my question to Emanuela is that often we see consolidated data from countrywide, but this report had a different approach. So they went facility by facility, of course with the limitation of a sample, not everything, but how much is important to balance between, knowing that is the national data or the real practice every day?
Thank you for your question, Andrea. My answer is it's very important finding a balance and try to integrate national data with local data. And the only way to do this is being on the field, speaking with staff members, working close with the community that have a deep knowledge about the community needs and about community challenges. This is related to multiple reasons to better understand the functioning of the health facilities, but also this is necessary to go in depth with the understanding of the multiple challenges, because the challenges experienced from one health facilities in a specific area can be different from the challenges experienced by another health facilities. For instance, we can better understand the health diseases managed by health facilities. In some areas, the challenges can concern maternal and child health, but in other areas, other diseases can impacting more on the population, such as the developing of chronic health needs related to non-communicable diseases. So there is talking with the people that are close with the community can allow us to better address the health needs and challenges, taking care of mother, children, but also of other vulnerable population, because as you know, the health challenges are many, and there is also an epidemiological transition from communicable diseases to non-communicable diseases such as hypertension, diabetes. So also the recruitment of health professionals have to take into account the multiple and multifaceted challenges. For instance, there can be a need of training implementation for newborn newborn stabilization or for better addressing maternal challenges and needs, but also some other facilities reported to us that they need more training regarding chronic disease management. These are just examples, but the only way to understand these needs is to be on the field.
Yes, we'll take two more questions here and then here. Go ahead.
Yeah, thank you. Mine is not a question really, but just a comment. Thank you, Emanuela, for the findings, which more or less similar to the situation in Uganda. I am a board member of one of the Uganda Catholic Medical Bureau hospitals, St. Joseph's Hospital, Maracha. Yes, yeah, in the West Nile. Yeah, and we do undertake maternal and prenatal death reviews. And largely we find out that some of these facilities some of these facilities have ambulances, but because of operation and maintenance of these ambulances, you find either late or delayed referrals, and this largely causes maternal death. So some of the issues are about operation and maintenance of these ambulances. Yeah. And then secondly, some of them have these medical equipment, but they don't have the consumables and the reagents. And therefore, this also delays investigations and diagnosis. Exactly. And eventually, we end up with the maternal and the prenatal death. Yeah. So just wanted to supplement. Thank you.
Well, thank you. You know, there's... You know, during the Millennium Development Goal period, the MDG, if you remember those before the SDGs, that made the least progress was reducing maternal mortality. It was about 300,000 at the start of the MDG period in the year 2000. At the end of the MDGs, it was about 290,000. Very little progress. And there's a saying that in some countries, and particularly some countries in sub-Saharan Africa, it's more dangerous for a woman or girl to give birth than it is for a man to go to war. It's just a completely unacceptable circumstances. And today is about 285,000 women and girls who die in childbirth each year. Over 90% are in low resource locations. And there's among under age 5 mortality, where there's been a lot of progress in general, mostly because of malaria, insecticide-treated nets, and other interventions. Newborn interventions have been very, very slim. So of the 4.9 million under age 5 children who died in 2022, which is the most recent data, 2.3 million were newborns. Almost half of all under age 5 mortality are newborns. So these are neglected areas. You know, much of the world's intervention has been around infectious disease. Much of the international investment has been around infectious disease, but there's really a need to deal with these other issues and to allow maternal mortality to be sustained at the rate it's at. And that doesn't account 10 million severe morbidities that happen to women and girls associated with childbirth. So you've brought that and many other things to light, and the ministry's comments support as well. I know we had one more question, and then we're going to go to the next session.
My name is Father Pascal from Kenya. My main area is bioethics. Thank you for the needs assessment which you carried out, which is actually meant to impact the lives of the community on the ground. We have heard of many communities which are over-researched. Many organizations are going to conduct research there, which does not directly benefit those vulnerable populations. I don't know what we can do as Cuamm and other partners to help the local community, first of all, understand their rights as participants in research, and to ensure that there is a follow-up, that after the outcome and the report of the research, the people on the ground actually benefit. Thank you.
Yeah, it's an important point. Yeah.
Thank you very much for raising these important points. And I think this is another emerging challenge we have to take into account. We have to work as Cuamm with local authorities and also local experts in bioethics to define the best as possible programs aimed to protect the rights of the patients in these countries and the rights of participants. Because the final goal of research is to find measures, strategies to help these people. So we have to put our attention on all the bioethics aspects that so far haven't been considered in these processes of research, and we have to define together with experts working inside the local communities, experts of bioethics, to define the standards we need to follow to be respectful with the patients and with the vulnerable population. Thank you.
Okay, well, thank you again, Dr. Parotto. It's a pleasure. We're now going to go to our final panel, and I'm going to invite 3 speakers to join us. The first is Father Dumisani Vilacati, who is the Regional Coordinator for Africa in the Dicastery for Promoting Integral Human Development. Let's see, your name is probably on a chair. There you go. And next is Sister Adjua Josephine, Sister Josephine, with the Secretary l'Union des Religieux dans la Santé et les Sociales in Côte d'Ivoire. Sister? This one, the most important one. And lastly, needing no introduction, is Andrea Atzori, Head of International Relations, Doctors with Africa, Cuamm. It's a very modest title for someone who does such important work, I have to say. All right. So we're going to start with Father Vilacati. And the question I have for you and for your remarks it's a simple one. How can the dicastery support local churches in promoting healthcare?
Good day, everybody, and thank you very much, Gary, for hosting us here together, of course, with Cuamm and the Embassy of Italy to the Holy See. I would like to thank all of you for inviting the dicastery to participate at this event. And I think the dicastery for promoting integral human development in the Roman Curia is one of the youngest dicasteries, born in 2017. But with the reform of the Curia in 2022, there has been also the new configuration. The way of working of the Curia has changed quite a bit, in such a way that the local churches become the protagonists of their own development. The new reform, the reform of the Roman Curia, that's the new constitution, gives a broad mandate to the dicastery for promoting integral human development, including matters of justice and peace, matters of human dignity, promoting human rights, as well as health. And obviously, health is understood in the area also of justice and peace. With the new configuration of the dicastery, we have 3 main sections, which is the first section is about listening and dialogue with local churches. The second section is about research and reflection. And the third section is about communications and restitution. So what do we do? Listening and dialogue is to maintain contact with the local churches, listening to their needs, their anguish, their concerns, their anxieties, and establishing this contact and maintaining it, and bringing this within the dicastery. It's probably the level in which we feel compassion for the local churches and for their cries and their needs. But obviously, things cannot just end at the heart where we feel compassion for people out there, but we also have to think about finding a solution. And that's how the second section, therefore, comes in of the dicastery, which we call research and reflection, which is the area really of studying the matter and trying to come up with solutions on how the matter can be addressed. And then eventually, once a response has been formulated, then a response is given back to the church. A restitution is thereby effected. I can say that because I belong to the first section, which is listening and dialogue, that this section indicates several needs in healthcare in Africa, including, of course, renovation of physical structures or building of new ones, medical equipment, medicines, medical personnel and their training as well, and especially also transport to reach the sick in their homes, but also people to access healthcare in the hospitals. So there is a lot of this, the need even of building more hospitals. Just last week we were in Accra, Ghana, and the bishop there wants to put up a hospital. And this is what he was sharing with us, that he wants to put up a child hospital, which does not exist really in Ghana. And he wants to be a protagonist in that area. So we, at the dicastery, the person responsible for Ghana now has to find ways of talking to the research and reflection team on how the bishop there can be assisted in providing this help to the peoples of Accra. So in a sense, I just want to also recall what you yourselves at Cuamm in 2022, when you met the Holy Father, when he said you are working with the people in Africa and allowing them to be the protagonists of their own development. And I think Cuamm in this way is a great organization, because then development comes from the people, but it's not just imposed from outside. And of course, this is what Pope Francis wants the dicastery also to do, to listen and then respond to the local needs, not to come from Rome, from the dicastery with a preconceived idea. So this is what has been happening since last year. And I hope that as time goes on, because this is a new configuration and it is maturing from within the dicastery. Last year, in fact, the Cardinal Prefect used to say we are on year 0, because at the moment we are learning how to work together ourselves. Now we are on year 1 to try and really make the machinery work better with the local churches. So in a nutshell, together with Cuamm, what we can do is to amplify the voice of Africa, to make the needs of Africa more known. And I know that within the dicastery ourselves, those of us involved in the coordination in Africa, we have felt that Africa sometimes is not mentioned as much as it should with the needs that are present there. Of course, we have to talk about what's happening in Ukraine, we have to talk about what's happening in the Holy Land, but we mustn't forget Sudan, South Sudan, Ethiopia, and all those countries that are going through tremendous difficulties. And obviously, when there is a war, when there is strife, healthcare suffers, and the response is required all the more. So sometimes when we listen to churches, because sometimes a local church can help another, sometimes things don't have to be given from elsewhere. I just make an example. I see that there is some form of presence of Cuamm, for example, in Zambia, but there is a bishop across in Hwange, in Zimbabwe, who has certain needs. We can always say, look, talk to your counterpart in Livingstone, he's already doing it, you can learn from him, and therefore learn from each other and get on with life. That's also our task, that's also our job, to network churches so that they learn from each other. And all that way development can go ahead and healthcare can be provided. Thank you.
So Sister Josephine, vous ne parlez pas anglais. Je ne parle pas italien. Sister Josephine is going to hear the question in English and respond in Italian, which means everyone in the room will know her response except me, but that's okay. I'm not the most important person in the room. So Sister Josephine, at the country level, it's astutely strategic to build a partnership between the public sector and faith-based organizations. And in your organization, you're doing a fantastic job of coordinating and strengthening the public-private partnership. So can you tell us what your short-term goals are in Côte d'Ivoire in the field of healthcare? And I think Sister Josephine already knows the question, so the fact I'm doing it in English is not putting her in a disadvantage.
Buongiorno a tutti. Mi dispiace che non posso parlare inglese. Sono Suor Adou Josephine, religiosa ivoiriana, con la mia comunità ad Abidjan. Sono la direttrice del centro medico Madre Maria Elisa Andreoli, che prende il nome della nostra fondatrice, un'italiana. Per questo motivo mi rivolgo a voi in italiano, una lingua che conosco solo un po'. Rappresento qui l'associazione URSI, che significa Unione dei religiosi e religiose nella salute e nel sociale in Costa d'Avorio. L'URSI è un'associazione apolitica, cattolica, non profit, creata nel 2005 e ufficialmente riconosciuta in Costa d'Avorio il 24 agosto 2020. La nostra missione è di contribuire al miglioramento della qualità delle cure e dei servizi all'interno dei centri sanitari e sociali membri dell'URSI, di facilitare l'accesso alle cure per la popolazione ivoiriana, in particolare per le persone con scarse risorse economiche. L'URSI è l'organo visibile che riflette il desiderio dei suoi membri di ritrovarsi per condividere le loro esperienze e preoccupazioni. Vuole inserirsi nella visione ecclesiale del Dicastero per il servizio dello sviluppo umano integrale e della sua Commissione per i servizi sanitari. Fino a novembre 2023, l'Unione aveva registrato 71 strutture membri. Sono strutture a volte piccole di primo contatto nei villaggi, ma anche ospedali e centri specializzati nelle grandi città. Gli obiettivi a breve termine supportati da Cuamm sono: primo, rafforzamento interno dell'URSI attraverso il miglioramento dell'aspetto manageriale, il rafforzamento delle capacità delle strutture membri attraverso formazioni sulla qualità delle cure. Secondo, rafforzamento esterno attraverso la stesura e la firma di una convenzione di partenariato tra il Ministero della Salute e l'URSI, che guida e favorisce le convenzioni tra ogni singola struttura e il Ministero della Salute. In questo senso, l'URSI svolge un ruolo di intermediario e facilitatore per i suoi membri nei confronti dello Stato. Terzo, visibilità e comunicazione interna ed esterna attraverso l'elaborazione della cartografia dell'URSI, la realizzazione di prospetti informativi, la creazione di un sito web. Per raggiungere questi obiettivi sono stati formati team misti di lavoro URSI-Cuamm, team legale, team monitoraggio e valutazione, team comunicazione e visibilità. Per raggiungere questi obiettivi, quali sono i bisogni dell'URSI? Bisogni di formazione nel campo della gestione, del management, della contabilità e delle finanze, nel campo legale, nel campo del miglioramento del livello delle cure per cure di qualità superiore, nel campo della visibilità e dei progetti. Bisogno di sostegno economico, specialmente per aiutare le popolazioni disagiate nell'acquisizione e manutenzione delle attrezzature mediche. Per concludere, l'adesione all'URSI sta aumentando per toccare più di 100 strutture sanitarie cattoliche in Costa d'Avorio. L'URSI è necessaria per parlare con una sola voce con il Ministero della Salute, che apprezza il nostro lavoro in sinergia con il suo piano di sviluppo. Una statistica fatta a novembre 2022 mostrava che le nostre strutture impiegano 1.355 persone e realizzano oltre 442.000 consultazioni generali all'anno, fornendo anche cure infermieristiche a 248.000 pazienti. Questa per citare solo qualche numero. Il nostro lavoro non è facile, ma è indispensabile per molti ivoiriani che hanno diritto a cure di qualità associate a profonda empatia, indipendentemente dal loro livello economico. È un obiettivo che realizzeremo anche meglio con gli amici di Cuamm e col vostro aiuto. Grazie.
Thank you, Sister Josephine. So it all comes back to Andrea, you know, a fitting person for being our last speaker, given how integral you are to all of this work. So together with the Cuamm team, with Father Dante, you've been the promoter of this grand project, and you played the role in between the people on the front lines, the field work, and the stakeholders that are supporting that work. So we've heard a lot about that this morning. So after this, all these interventions and this great discussion that we've had, what do you think is the path and direction to follow now? And maybe you can provide some examples as well.
Thank you, Gary. First of all, let me thank you, the Italian Embassy, of course, for hosting us in this beautiful palace and giving us the space to discuss. My first reply is in front of me, is the diversity and the kind of commitment we see this morning. I think that's what we want to see more happening. But the reality is that it's the African continent, maybe the world, that is facing huge challenges at the moment, and challenges that no single actor can address. So we have the climate change, we have the economic crisis, we have a number of infinite humanitarian crises we are not addressing, and they get chronic. So this is very dangerous. Climate change means that the Catholic Hospital of Shulo in Angola, every 6 months, have huge spikes of children coming with malnutrition. And alone cannot afford to treat them, to follow them in the community, to transform the agriculture. So there is lots of work to be done for a single Catholic unit. The economic crisis means that salaries are becoming a problem for FBOs. The inflation, and it's right that nurses are paid correctly, but at the same time, the budget that was working only 18 months ago is not good anymore. So we need additional resources. And where these resources are coming from, we don't know. Because again, the third point, the humanitarian crisis are drawing resources. It's natural. I mean, it's drawing resources from the development, from the capacity, the development of the capacity of the local infrastructure or the local human resources. So the key for me is a word, is partnership. Mm-hmm. Partnership is essential and is efficient when it's able to transform life in the last mile. Okay? So when we talk about partnership, I see in this room, so I don't need to go far, I see in this room donors, I see in this room companies, I see in this room governments, expert, technical expert, NGO, institution like Italy. Italy has a word for that, it's called Sistema Italia, Italy system, in which they want to put together all of these. Because I make a very clear example, no? I have a donor, and there is the myth that money can change everything. But that's not true, because money are only good if they become services in the last mile. Otherwise, all the big funding mechanisms, sorry to say that to people present in the room, are useless, because this money need not to trickle down, need to flow directly to those people in the last mile that every day save lives. So be straight on that. It's not like a fancy word. They save in life, as you said, and they save in life with iPhone light. So I think the partnership is how can we devise something that put the last mile at international stage, knowing that there is a big problem here. And one of the big problems is also that no single facility often has the capacity to apply to UK, US, or private foundation grants. So the colleague from NI was mentioning how I think, if Father Dante agrees, also NGOs should transform their way to see their work in Africa, how they can be a point in which they empower people like the sisters to perform better, allowing them to networking, and maybe through Cuamm, that has the administrative and the policies and everything, get to higher stage and get some resources. The other point here is that there's another person in the room that is fundamental, that is Tom, because we need government that are enlightened, government that understand that partnership with FBO is not concurrency, is efficiency, is efficient, because they have the trust of the community, they are in the last mile. So there is no point, again, I go very straight on this, to build a public hospital beside maybe a Catholic facility. And Uganda has been excellent on that. They have a national agreement, they have lots of experiences. So I think really what we need is the international community looking at delivering services, government looking at the partnership at their own level, and at the bottom of these, they should be the top, not the bottom, how can we really strengthen the local capacity in terms of training, in terms of human resources, even some infrastructure. I mean, in the report from Emanuela, I was struck because if you look at the graph of energy access to the grid, is very high. So they are connected to the grid. If you ask to the sister, 150, 200 days per year, they don't have energy. So that's why we need also to think about the bottom side and how can we strengthen them and not only looking at the macro data. So this is, I don't know if I've been clear on that. I think there are many challenges. I think that, again, with the help of local government that are themselves in power, because, for example, the importance of URSI and the work of Cuamm with URSI in Ivory Coast is to have the map of the need and the map of the facility. They don't have that. When you have that, you go to the Minister of Health. When the Minister of Health has the map, they can make strategic decision. And when the Minister of Health makes a strategic decision, can engage with Cuamm international donors. I think that's the way forward, at least for me.
Thank you. Thank you. If I may, let me point out two other things that I've observed about Cuamm that I think make it uniquely suited to provide, I'll use the term again, return on investment, meaning that donor funds or government funds are going to go to absolutely good use. One is, it's known that in foreign development assistance, often it comes with a lot of, I'll call it bureaucratic paperwork, a lot of reports and forms, proposals, and sometimes organizations operating on the front lines have to staff up just to feed the information requirements from their donors, which include private foundations, requiring a lot of justification, data, and reporting. Now, of course, there's a reason for that, but in my experience, you talked about reversing the pyramid, reversing the triangle. You've reversed that. Your focus is on getting the work done on the front lines and working with your donors in a manner that reporting doesn't overtake the work itself is one thing. The other thing I would say is, we talked about loss of electricity. I'm going to say this by analogy. If you have an electrical path and you have 100% energy going in on this side, if it's inefficient, by the time the energy gets to the other side, maybe there's only 20%. It works the same way in foreign development. Sometimes you have 100% funding here, and by the time it gets to where it's really needed, what's left of it? It gets absorbed along the way. Now, hopefully something's left. My experience with Cuamm, it's 100%. The organization, okay, maybe it's 98.99%. The organization is so modest and efficient in how it operates that as a donor, and I'm also a personal donor, I know, if I donate X amount, something very close to X is going right to the front lines. So it's really important. I mean, that's something anyone who's in a donor situation should be thinking about. Any thoughts on those comments?
No, thanks, Gary. I don't give any thoughts about Cuamm, so you said it. So, no, again, we go back to some strategic decision we had to make. For example, if Ivory Coast has 68 hospitals, does it make sense to create 68 projects, 68 administrative processes, 68, or it's better to have like a nice 1 or 2 projects maybe that are administered generally and divided equally in order to be more efficient. Okay, so I think one of the way is to find, again, the most efficient, as you say, way, but also to maybe using NGOs, I say, but there will be other institutions. They already have the administrative capacity to make sure they can deliver to those on the last mile. I think this is one of the way ahead. The other thing you said is that we've been talking about many issues. So we go back to the partnership. For example, I'm sure Father Dante will agree. Cuamm is specialized in healthcare. Okay, but there is nothing wrong if we partner with an NGO that specializes on water or energy. So we also have to look to be more strategic in that sense. I don't believe NGO can be doing everything and be doing everything. So I think also looking at the way in which, in a transparent way, with data, with maybe research if needed, or this report we're presenting, in each sector, the NGO is really capable to support the last mile.
Okay. So thank you again, Andrea. So we've reached the point now where we've, the official statements, the official discussion is complete. We're going to go into questions and answers. The questions and answers will be for any of the speakers. I'm going to ask the 3 of you to stay here because you're here. Otherwise, you'll leave me alone here. But please direct your questions to any of the speakers that have talked today, or if you have a brief statement of solidarity you would like to make as well, that would be fine. I see Laura in the back ready with a microphone. So anyone who would either have a question or a comment, I'm inviting you at this time. We have time, and then we're going to have a nice light lunch afterwards. I don't want that to be an incentive not to ask a question. So please, still, anyone. Has to be always the first one is always difficult. Laura, do you have a question? You have the microphone. No? All right. So we, yeah, okay. We have one here. Keep coming, keep coming. There you are.
Mine is not a question this time. It's just to comment on the job Cuamm and other partners are doing, and to affirm that assisting Cuamm to help the faith-based organizations, especially in matters health, is quite crucial and important, because the FBOs then would focus on their real mission, which is not only offering health facilities or health services, but offering them with the values which they have. You've mentioned values of faith, you have mentioned values of charity, values of integrity, of trust. If we don't assist them, what happens? They cease being FBOs as faith-based organizations to faithless-based organizations, which is going to be very risky, and they're going to have conflicts of interest instead of their primary interest being where they're supposed to be. The secondary ones begin overriding the first one. And the secondary one would be now they'll be struggling to survive, they'll be struggling to make profit, and forget about the values of the FBOs. Thank you.
Thank you. In the back, Laura.
Hello, thank you very much for this nice event. So I am Adela González. I have been working for many years in Manos Unidas in Spain. So we have been working with Cuamm. I had been also visiting Tosamaganga Hospital in Tanzania. It was amazing. So for me, it was very important. One thing, many things, but well, this, let's say, to find so many young people so motivated to learn and to help others. So this is wonderful. This is a very important thing. And, but my question is, there is a very important challenge that already Andrea mentioned, that, we have been working many years on different niveles. So from donors from the north, telling people how they should do things, and people doing things. No, this paradigm is died. So we are on a new paradigm. So Father from the Dicastery mentioned it, and Father Paul from Kenya, I think too. So, this is the big challenge we face, and we can be the protagonist, the faith-based organizations of this challenge. So a very important thing is how to empower people on the field to be the real leaders of the projects. So this is the big challenge. So if you can go deeply on that, thank you.
Okay, we'll invite any of the speakers. Would you like to start? It looks like you want to start.
I am happy that she has mentioned the issue of the paradigm shift, the fact that local people should be the protagonists of their own development. And I guess it's a challenge for, I am new in the dicastery, but it is a challenge for my colleagues who have been there for all these years, because for them it has always been, we know what the church needs, we do a document in Rome and send it out, and everybody must behave this way. But now when the needs come from the other side and you are asked to respond to that, it's a lot more difficult, because it's not preconceived. You have to really respond to the specific need. And I know some people were always used to be called to Rome for big summits, you know, to talk about something that Rome had cooked and thought of and that people needed to know. But now the thing is, no, we are going only to have a summit at a local level because the people there have expressed a particular need. So even in healthcare, I'm sure it will be the same thing, that it is the same thing, that what does the local situation require? Of course, it may require external help. And I think that's important, therefore, for organizations like Cuamm to be able to respond in this way, because they have a much more wider network. And as for me, because we listen to many churches, I will be obviously directing people to knock on Cuamm's doors, so that I will of course, make you work even more, and so that they can learn from this very healthy network. Just a month ago, we're in South Sudan, and the Chargé d'Affaires there said to me, the Apostolic Nuncio said, look, for us here, when we have health problems, we go to Cuamm. And that was encouraging. I mean, that's a good story that I bring from South Sudan, for example, in this area. So you are making an impact, even at that level. I mean, that at that level of Sudan, the Apostolic Nunciature is aware of the good work that Cuamm does. So thank you. I think it's a good development, positive, well done.
Yeah, wonderful. So you mentioned a big meeting in Rome because something Rome has cooked. If Rome is cooking pasta, then you come here for the big meeting, because it's the best in the world. Any other questions or comments? Yes. Juliet.
Thank you. Just to compliment, I would say that the United Kingdom is now developing a locally led development strategy, building on the commitment that we set out in the white paper. It was going to take us a while, because there's a lot of people we want to listen to over the next year or so. And so there's a lot for us to learn, actually, from what you've been saying and from Cuamm's work. And we're very keen to continue to work with you to learn about what works best in terms of putting local people at the forefront of their own development. So thanks for that.
Wonderful. And Peter?
Thank you. Thanks, Juliet, for that comment. And just to add to that, the United States is doing a very similar thing. At USAID, we have a very strong emphasis on localization, we call it, our localization policy. And again, the idea is to listen to local voices, to solve local problems, and to try to get more resources, frankly, in the hands of local organizations. It gets complicated. It bumps up against the accountability requirements that our Congress puts on us, right? Because these are public funds, these are taxpayers' funds. So to the extent that, Andrea, to the extent that Cuamm is helping to find solutions to help better manage public funds, that helps us to achieve our localization objectives. So thank you.
Absolutely. Okay, any other questions, comments? Looking, I'm seeing faces, in the back. Go ahead.
Hi, my name is Ginny. I'm here to represent Global Solidarity Forum, and solidarity is a big philosophy, a value for us. It's very much like Cuamm. And I have to I have a comment and probably a question. I have to applaud you for organizing this event because I love seeing sisters, fathers here, the government of Uganda, international development cooperation, foundations, private sector, so all these actors in the same room. This doesn't happen enough, in my opinion, and it's great that you instigate this. And I think to make that change, the systemic change, it will require everybody to work as a team. We can't expect one actor to fix everything, like you said before, so that's great. I think one thing we've also, my question to you is a simple question, is do you plan to organize similar events like this in Africa? Because one thing we've noticed also when we work in African countries, because we have projects, is there's a lot of really good actors on the ground already, local experts. And I see a lot of discussion and from the UK and USAID talk about localization. There's a lot of experts and expertise and wealth in the country that FBOs can benefit from that they don't have opportunity to connect with. And I think organizing similar events in countries is actually really beneficial. We've tried this in the small scale level. We've seen very similar interesting conversations and discussions. And I think empowering the voices of FBOs in those situations is very important. So I'm curious whether you've got plans to do the same thing in the countries you operate.
Maybe before you answer, I just want to comment on the importance of the question. Now, we used to talk about rich, middle income, and poor countries. And nowadays, it's really not the same. Now it's rich, middle income, and poor populations in almost every country. I mean, you can find billionaires in countries in Africa, industry leaders who have a lot of influence and probably would welcome an opportunity, a viable opportunity to give back. You can go into rich countries and find very impoverished populations, among other things, people who cannot access healthcare or certainly cannot do it affordably. So I think it's a great question. What do you think, Andrea?
It's definitely a great question. So we've been debating a lot about doing this meeting in Rome or in Abidjan or another place, actually. I remember we had a few discussions about where is the best place, but also we thought that it was necessary to go step by step. So I think that this project had a strength that was to highlight also what the dicastery is trying to do, the map. Where are these people? What are the problems? And how can we help them? And I think the Rome event now was because we could get like the higher stage. So in my mind, there are two steps we have to do now. One is that in Ivory Coast is already ongoing because we work with Ursi on that. And we already had one meeting that we may have another meeting with the Minister of Health as well. But one way will be to have local, I won't call it events, but let's say gathering in which we can discuss practical things. So what is an agreement like? What kind of paper a facility needs? What kind of requirement the Minister of Health has for them? And the other one is to share African practices. I think you said it as well, because, for example, the Uganda model can be exported. It's great. They already done it. They have a track record. They have the data. So it will be very interesting to have like Uganda's going to Abidjan, maybe sharing with them, or even more difficult country like Central African Republic that is French speaking, learning from Ivory Coast. So that is something that we actually present to Hilton Foundation. Of course, we are going to present to GSF as well, a project on that. Thank you for your question. But I think there are two steps in my mind in terms of events. The other thing that I want to be clear, and I want to apologize the sisters, is that this project has been mapping needs.
is not been responding to all the needs we are mapping, we can't do that, unfortunately. I think Ivory Coast, we are doing something in depth. It was impossible to do in 20 countries for Cuamm, of course, so I want to be honest and apologize for that. But knowing the problem is part of the solution. So that's, I think, what we achieved.
I'll make one other pitch for Rome also. It's not just pasta. If you're having a faith-based discussion, this is a unique city for that purpose, for sure. Okay, any other questions? Yes, right here.
I'm Renato Laforgia. I'm speaking for myself. And I've got a very naive question. I wonder if the disproportion between profit organization and countries and no-profit organizations can be re-equilibrated. In the sense that, for instance, I take the example of ENI that had lots of investment in Africa at the moment and had an income in 2022 of billions and earned about 132 millions. I wondered if it could be given a part of this money to generators to avoid the lack of energy in peripheral hospitals.
Hello. Thank you.
It should come on.
Yeah. Thank you for the question. We need to go a little bit through the data because the income is one thing, the investment and the amount of investment is another. What I can say is that speaking about ENI, we have a particular story that is related to our approach to the business. That now, before was a Mattei approach, not Piano Mattei, but the approach of Mattei to the business. Now we call it dual flag approach. So the approach to the country is to share from our side the knowledge and part of the investment with the local entities and to share also the income of the business. So the ways to do 50-50 with the local institution. Then there is also practical, we can say, approach to the investment, community investment. So in each project, industrial project that we together with the local entity decide to develop, we invest a quantity of the budget for local development. So this is our approach to industrial projects. And part of this investment is also dedicated to health, access to medical treatment, healthcare, capacity building, and also access to energy. We are one of the energy company that are investing in the local market. If we look to Ghana too, to Congo, to Libya too, we are the player there. With losing also a little bit of the potential of income we are investing in the local market. Okay, we may, as everybody, do more, but at the moment, consider that we are not a public company. we have to respond to our investor. So is a problem of sustainability of the business. And this is something that is addressed to E&I because we come from the property, public property, so from the Italian institution, but now it's not anymore like that. What is important is what was discussed today, so to give to our company all the information, a real picture from the field, to understand exactly, to underline exactly what are the needs in order, with the language that we can understand, and the language that we can understand is related to the reporting, to indicators, and so on, in order to address the investment connected to the business for the local development exactly to the real problem, and to avoid the percentage that maybe is kept by the intermediate companies or entities. So if you learn the way to speak with us, and from our side, if we adopt the right approach to speak with you, we try to optimize the benefit for the local people. It's a problem of a relationship. Thank you.
So maybe now, as we break to we're going to go to final remarks, but I just want to comment also, having had the opportunity and the perspective of working in the business sector, being a founder and running a nonprofit and serving as board chair today that is operating globally in 24 countries, working with UN agencies as a UN commissioner, as a board member of UNICEF, and also working closely with the world's largest public health agency, the Centers for Disease Control. It's giving me this 360 view. And my short piece of advice would be, my observation is, it's not so much which sector you're from, it's who's in the organization. And we need to infiltrate organizations in each of these sectors with good people who see their role in life as more than personal success, personal wealth. Of course, people in business, just as you said, if we think about funding, Cuamm cannot survive without being funded, and it's mostly donor funding. In business, you cannot survive without profit. Profit is your source of funding. Now, you have some people, maybe more in business than in other sectors, who are motivated by that. But if you infiltrate those organizations with good people who see their purpose, their role as being greater, if they do that, by the way, they're going to have a better life. They should know that secret. Then you can actually tap into the reach, the resources, the competencies that exist in the private sector to accomplish good. And there's been a general movement in that direction. If you think about ESG as an example, environmental social governance, here we're talking in a big way about the S, the social side, also about the E, the environmental, because that's affecting the social side. So part of it is, I think, when we talk about accountability, it's a word that's used a lot at the UN. What's the accountability of organizations to have people with the right motives in their organizations? Starting at the top. Who's the leader? I mean, look at who's at the top of this organization. It speaks for itself. You don't even have to question anything. You see the goodness just flows through the organization. It's picked up by others in the organization. They live from the same values. This is what we have to strive for in every sector. By the way, I've seen people who work in public service, in nonprofits, academia, sometimes very self-motivated, you know, with professional jealousies and rivalries. These things exist in every sector. So that's what we should push for. Have people with the right motives. And then find people who collaborate well together. These big problems, it was said by twice tonight, these big, difficult challenges can not only not be solved by one organization, they can't be solved by one sector. You could take the whole private sector, the whole nonprofit sector, all governments, every UN agency, they can't solve the problems on their own. It's through the collaboration across sectors that you can take on big problems. And you have to have people willing to take on big challenges, not to say, oh, that's too difficult. Let me go back home, sit in my comfortable chair, put on the TV. It's so much more comfortable. That's not the way to live your life. Anyway, if you do, okay, it's fine. I'm not going to criticize. But you can live a better life in another way. All right, so we are at the point, you're welcome to stay here, or if you're more comfortable, you're welcome to go back to your seats. It's up to you. 'Cause we're gonna have some concluding remarks, Andrea, and make sure we're acknowledging the people who made this wonderful event possible. So let me turn to you for that, okay? Yeah, I think,
Wow, that's difficult. I don't know if you want to help me. No, no help. No help from the top.
Lots of help, but not for this.
Any donor? No. Okay. No, I mean, Gary, thanks. Thanks for moderating this. Absolutely. This project will not exist without the congregation. So all the sisters, thank you very much. Okay, coming to Rome, of course. Sister Sandra, there was a bit of the starter. Yeah. We have a wonderful picture with Sister Sandra that call all the colleagues, Mother Generals, in her place to have the first meeting. I think it was 3 years ago, something like that. Decided to start this project, so that was great. Of course, the Italian embassy again for the venue and lunch, but also there are 2 people in the room that have been working a lot for this project. So I would like to thank Maria. She's the project manager for this. And of course, everybody knows because you've been spammed by email and WhatsApp, Laura. Thank you, Laura, for that. And of course, we have also Valentina, Linda, and Flavia, and we're working on this. We also have special people, like you should say that this, because we already.
School for nurses and midwives as a strong collaborator together in Ethiopia.
Thank you. And really it's lunchtime, so I want to conclude this. When we organized this event, going back to your question as well, we said this is not like a closing event. This is the presentation of just the first step of something that should be much bigger. So the report is really a milestone for us. We have to plan for the future. We have to do more localization. We have to engage with more people. The needs are great. And again, no single actor who came in the room can solve this problem. So really, everybody can help. Everybody can contact us, can contact the sister directly. But let's do it. We can do it.
I'll just say, last comment, this is the end of the beginning, not the beginning of the end, right? Okay. Thank you, everyone. It's been a pleasure.